Hello, Mrs. R.
Hello.
I understand you had another asthma attack. How are you feeling now?
I feel a little bit better, thank you.
Okay, well, what I'm going to do is we'll get you your next set of meds. I'll go ahead and have Nurse Brandy come in and help finish up and check in with you, and I will finish this up and we'll get you out of here as soon as we can, okay?
Thanks.
How are you feeling today?
I've been better.
How would you rate your pain on a scale of 1 to 10?
Probably 7.
This is the 5th time you've been in this week. Is there anything you've been doing to trigger your attacks?
Not that I know of, no.
Well, let me go talk to Dr. Will and we'll update your file.
Thank you.
I gave her more morphine because she rated her pain at a 7. I think this is because of her multiple sclerosis.
Well, this is kind of a hopeless case at this point. Ever since the divorce, she's just been struggling with money, and if you could just, get the rest of the information, put it into her file for me, and get her out of here before she wastes any more of our time and resources, that'd be great.
Okay. What's this no code you ordered?
Given Mrs. R's unstable home environment and her deteriorating physical condition, the no code is the best option for her and her family.
Well, did you decide that, or did she?
She is dying of this horrible condition already, and all parties involved will get the best utility from the no code at this point in her condition. Hi, Savannah. Dr. Will. Yes. Could you swing by the hospital, please? I'm having an issue with Mrs. R's case file. Yeah, the nurse had some questions about the no code that was issued. I just want to make sure that we get it all straightened out. Okay, see you soon. Yes, come in, please. Oh, hey. Thanks for coming on such short notice.
Absolutely. What can I do to help you?
Well, Nurse Brandy approached me about the no code earlier today, and I was struggling with giving valid reasoning as to why it was issued. So, hypothetically, how would you go about legally justifying a no code without having consultation from the patient or family?
Your duty as a doctor is to take care of your patient. And if you believe that the no code is the best choice for your patient, then that's your lawful duty as a doctor to make that decision. Are there any other factors that would go into it for her not being able to make a decision for herself?
Well, the patient lives in what's been referred to as an intolerable home situation by nurses and, of course, by herself. On top of that, she also has multiple sclerosis, which at this point is incurable, as well as frequent acute asthma attacks.
And do any of these symptoms lead to the patient not being able to make decisions for herself?
Multiple sclerosis has been shown to cause severe neurological damage over time. In addition to the numerous symptoms of internal physical complications of MS, the medication used to treat it can cause mood problems, such as depression, feelings of hopelessness, and even self-harm or suicidal thoughts.
All of these side effects and symptoms, it would seem that she could potentially be worse off having to face the decisions by herself, and it wouldn't be in the most responsible manner for her or her family. Since she's understood to be incapable of making these decisions, it should be made by someone who is the most medically educated, I would say, and informed on her case. So, as her doctor, it's your duty to make that decision for her. And if that's to uphold the no code, then it would seem that that's the best option for her in her interest.
I really do think that this is in the best interest of the patient, and the no code itself is the right thing to do. So, thank you so much for stopping by on such short notice. Yeah. Let's grab lunch sometime next week.
Yeah, I'll see you around.
Well, thank you.
How are you feeling now?
Feeling okay, I'm just not looking forward to going home.
Oh, why would you say that? Are things bad at home?
Well, yes, I mean, things have been so hard after the divorce, and I know it's hard on the girls. My ex and I fight constantly.
What would you rate your home life on a scale of 1 to 10?
Pretty low. I mean, some days are better than others, but it's usually pretty bad.
Do you ever feel depressed?
Yes.
Well, just so you know, there are medications out there to help treat depression and help improve your quality of life.
Well, thank you for consulting with me about it. I firmly believe that decision should be left to the individual.
Oh, absolutely. It's your natural right, and ultimately it's your life, and your happiness is at stake.
The act in and of itself of you asking me is the right thing to do. You could have easily made a decision about what's best for me without consulting me first, and I'm glad you didn't take the decision away from me.
Of course, it's my duty. Let me go grab you a list of medications we typically prescribe for depression. Hello, Dr. Will. I took the liberty of talking to Mrs. R about her mental state, and she seemed pleased that I did. I have suggested multiple options that may help her depression, and am retrieving a list of medications for her to take a look at and choose for herself.
Ignoring the fact that you overstepped your bounds, yet again, I've made the decision as her doctor. Okay, meaning that when our patients are in an unstable frame of mind, it is my duty to make my best professional call on how to handle our patients.
It's our duty to help get Mrs. R in the right frame of mind, that way she can make these life-changing decisions for herself.
Even if we are able to improve her depression, she is in severe pain, and her physical condition will only get worse. She's declining, and choosing to charge her for more medication complicates what she should already be taking. In short, it is a waste of the patient's and our own time and money, and now it's the nurse and the doctor stuff that needs to be recorded, I think. And that's it, though.
Yay!
Yay!
Are you ready?
Yep.
Hold on. Alright.
I'm done.
And then, I guess, no.
I don't know, you might like grab the couch or something.
It's weird.
Yes. Drama.
Yes.
Let me go grab you a list of medications we typically prescribe for you.
Were you good?
Think so?
You want to look them over?
How are you feeling now?
I've been better.
What
Shit,
would
I
you
already
say
said that,
then?
didn't I? Okay.
There's gotta be for real.
Don't put that one in. I'm like, oh shit,
Shit.
that's not Okay. Been better.
What levels?
Go.
Look, good. Looking good.
I gave her more morphine because she rated her pain at a 7. I think her pain may be at this level due to her multiple sclerosis.
That's what I wanted to say, but I was like, well, that's dramatic.
I gave her more morphine because she rated her pain at a 7. I think the pain may be because of her multiple sclerosis.
Well, multiple sclerosis is...
What was that?
bad.